Vomiting rarely has any warning signs, and many of us can attest to its often surprising onset. Treatments range from home remedies to over-the-counter therapies to prescription drugs. So what's the right one for you? Well, we have two special guests with us, a pharmacist and a mom, who are going to answer that question and give us some advice along the way. So Susan, what are some of the common ways of treating nausea and vomiting?
There are different ways to treat nausea depending on the cause. Certainly you would want to avoid solid food during a vomiting episode. It's important to sip at fluids and start with smaller amounts and work your way up to larger amounts to remain rehydrated. I like to give people the Brat diet: banana, white rice, cooked apple, and dry toast. Those are all things that you can nibble on and are good for your tummy. If you're on medication that you already know is irritating to the tummy, you should check with your physician if you could stop that for a short period of time. And also, if nausea and vomiting continue, it is important to check that out with your physician as well.
What about prevention? Is there any way to prevent nausea and vomiting?
Well, there are a few ways to prevent nausea and vomiting. Certainly, if you wanted to have a little something to eat while you're feeling like that, try to choose foods that are cold or room temperature, because just the smell from warm foods can trigger nausea. You should be sipping clear, sweetened fluids like soda or apple juice. And to help prevent nausea and vomiting, you could use an anti-nauseant.
So Susan, how do these anti-nauseants work?
Well, anti-nauseants are over-the-counter medications that can be effective in dealing with nausea and vomiting. Most of them are an oral preparation that are absorbed in the system fairly rapidly to calm the symptoms. A relief can begin within 15 to 20 minutes and last for hours, depending on the dosage form you've selected.
Okay, well, Karen, as a mom, you use Gravol at home and at work. Tell us why.
Well, we always had it at home ever since I was a kid myself. My mother always had it on hand for when we had nausea and vomiting, even motion sickness. And I've used it as well for my own children as well. And it certainly works for the nausea and the vomiting effects.
So what are some of the side effects of Gravol, Susan?
Well, any anti-nauseant like Gravol can make you feel sleepy. There is a ginger-based Gravol that is non-drowsy. When you're using an anti-nauseant, such as Gravol, you should take it a half an hour before you get in your car or on the boat. And it is worthwhile noting that if you're already motion sick, it will still work.
Good to know. So what do you like most about Gravol, Karen?
Well, actually, not too long ago, a pharmacist did recommend that I purchase the ginger-based Gravol, and we used it in my business. We recently chartered a boat and had it on hand for our clients so that if they did get motion sick, it was there. And as a matter of fact, somebody did need it, and it worked great.
And they stayed awake.
Yes, they did. They did. It was wonderful.
Well, thank you for being here and sharing these tips and giving us some good advice.
Thank you.
Great. To find out more about treating nausea and vomiting, visit gravol.ca.